then here's the odontoid process. Basically, that's what takes the place of the body of C1. Then we talk about the atlantoaxial joint. The C1 is also called the atlas, and C2 is the axis. And this is where half of all the rotation in the neck occurs between C1 and C2. And there is a little bit of like transverse motion, like this. And then there's specific ligaments that help hold in that area. There's significant ligament is the transverse ligament that holds that odontoid process, because you have C1 like this and you have the odontoid process. The front of the odontoid process articulates with C1, and then you have a ligament across the back that holds it in place. And then now when you start going into C2, from C2 to C5, or 7, I mean, those are going to be kind of uniformly similar. Obviously, C1 and C2 are totally different animals, but the rest of them are going to be similar. As we get down towards C7, they're going to start becoming more like a thoracic vertebra. Whereas you have these upper ones, you have what we call a bifid spinous process, meaning that it splits into two parts, and it's more going straight like this. As you get down to C7, T1, the spinous process tends to angle down like that. It tends to be longer. All right, so now one of the significant things is when we talk about vertebral motor unit. And let's see. Basically, the anterior motor unit is going to be here where the vertebral body is. So you have the vertebral body, you have the anterior longitudinal ligament and the posterior longitudinal ligament, and then you have these, what we call the joints of Luschka, which are on the side of the vertebra. Okay? That's the anterior motor unit, and then behind it you have the posterior motor unit, which is this vertebral arch. You have the articular pillars, the lamina, and the spinous process. So when we talk about vertebral motor unit, that's where the motion occurs between the vertebrae. Obviously the vertebra is a solid piece of bone, and then there's another one underneath it, but everything in between those two is movable. Okay? So you have the vertebral disc, where the movement occurs there, and that's the anterior motor unit. Then you have the posterior motor unit where the facet joints are. So like I say, here you have the posterior element, you have the vertebral arch, the facet joints, and then the ligaments that are involved with that is the joint capsule itself, the ligamentum flavum, and then you have interspinous, of course, would be between the spinous process. Intertransverse would be between the transverse process. And then you have a supraspinous ligament, which basically sits on the tip of the spinous process, and then that continues back into the ligamentum nuchae, which goes straight back to the skin. All right, hopefully this will work, but what this is going to be is a motion video. Can you cut the, oh wait, let me make sure if it works first. Maybe not. Well, we'll try to get that going another time and see it. Basically, what happens is down at this lower part between C5 and C6, that's where most of the flexion occurs. And that's important to know because most of the time when you see DJD in the neck, it's going to happen where? Where do you think? C5, C6. So the greatest amount of motion occurs at C5, C6. And then that's where, because of that, you're most commonly going to see the DJD at that level.
Could you point out C5 and C6 again on that?
Yeah. Okay, here's 1, 2, 3, 4, 5, 6. There you go. Okay. So then, like I said, C1 and C2 are different animals together. And then when you talk about a typical cervical vertebra, then we're talking here about C4, for example. The body is pretty small. And then the majority of the weight in the cervical spine is borne by the vertebral bodies. Okay? I think we have that. I know in the low back, we usually say that 70% of the weight's on the vertebral bodies and 30% is on the facets. And I would tend to say that it's the same is true with the cervical spine. And then the discs help give shape to the cervical spine. Now the facets are angled. The angle changes as we go from the top down to the bottom. Okay? I don't know if people can see. Probably when you over there, I'm probably standing in the way of that, right? So you can see the angle of it here. And because of the way the facets work, is that you have a combined motion of rotation and lateral flexion. Because if the facets are like this, your neck moves like this. Because in the plane of the facet goes. So lateral flexion and rotation occur together at the same time. Like that. And then the joint capsule or the ligament is sensitive to pain. So when people have like facet injuries in the neck, we'll talk about facet syndrome. So you can have the facet joints and then the joint capsules are sensitive to pain. And then we have what's called the uncinate process, which is this little lip right here. What that does is it helps to keep the cervical vertebra aligned in flexion and extension. You have USB on there, right?
Yeah.
So again, here's that uncinate joint right there, and that tends to align the spine for flexion and extension. So now we're talking about the differences between the cervical, thoracic, and lumbar. Again, in the cervical, the bodies are smaller. They get bigger as we tend towards the lumbar. The shape changes too. Here it's almost more of a triangle shape. Here it's like a kidney bean shape. There it's almost more just a straight rectangle. And then the facet joints, we'll talk more about those as we go. The facet joints in the cervical are like this. In the thoracic, they're pretty close to the cervical. But in the lumbar, they're like this. They're mostly sagittal, but as they curve forward, they have a coronal component. But in the lumbar spine, the facets allow more flexion extension. In the thoracic spine, there's not a lot of range of motion. But again, in the cervical, it's a combined rotation and lateral flexion. Then we talk about the discs. Then we talk about the discs. So we have, and you've probably heard of these before, right? You have the annulus fibrosus and the nucleus pulposus. So the annulus fibrosus are the rings that go around the outside, and then the nucleus pulposus is the gelatinous material on the inside. So let's see now. These things are on this sheet here, so you want to make sure that you know the functions of the discs are basically to act as shock absorbers. Okay? And you need to know what are the parts of the discs are composed of. Okay, so what are those?
Annulus fibrosus, nucleus pulposus.